Thank you so much, Dirk. Thanks for the introduction. It's really nice to see you all here. I'm really excited for this opportunity to really give and to share actually my past and current work. I think it's always reasonable to ask what progress the field has made in certain areas over the past decades. And I hope that, I'll give you my perspective as a neurolinguist and a physiologist. So today I'll share the past and ongoing work conducted with Northwestern and the UCSF collaborators and my mentors. And in the first part of my talk, I'll focus on categorical differences. I'll present some evidence suggesting that the lexical system is highly specialized for processing words with a certain property, and through investigations of patients with both progressive and acquired brain disorders. In the second part of my talk, I'll focus on category ambiguous word forms and experiments we are currently running, but due to COVID, we're still collecting the data. I really think that these category ambiguous words are very informative with respect to the nature of lexical representation. So let's start with a little theoretical background. I will not go into much detail of various views of the lexicon, but I'll briefly describe some characterization of the lexicon that have appeared in the literature. And initially, in these minimalist conceptions of the lexicon, there is two systems, right? There is a computational system, that is the rules that form syntactic constructions, phonological, semantic patterns. So based on these few lexical items are understood as bundles of features. So we will always be able to develop words with a certain property. And that's why we can differentiate, let's say, functional words from lexical words, or differentiate nouns from verbs. And then we have a conceptual system, which involves more system of objects and also such relations like an agent, goal, instrument, what we sometimes call thematic relation. I'll talk about that later. These two systems are kind of linked to each other and differentially represented in the brain, but we don't still know the neural correlates of each of them. On the other side, others proposes a sharp dichotomy between stored and computed words. The words kind of rule division theory. And according to the clarity memory system, temporoparietal medial temporal areas, they consist of these memorized words. So words that are not constructed by the rule, and they just have to be stored in our memory. In contrast, we have this frontal basal ganglia procedural system that can process morphologically complex words, or all the words that are constructed by the rule and they are not stored in our memory. A very different view, right? And then, something that we all kind of, I would say the most influential one is the stage models. And according to this, regardless of the specific functional architecture of the system, the stage models agree that linguistic information about the word is represented at three independent levels: semantic, lexical-syntactic, and phonological level. So therefore, when we're processing words, we need to go through two stages. We need to link the semantics to words, and then a second stage, words to phonemes or word forms. So, irrespective of any of these theories, which one takes to believe, there is many others, right, that propose other kind of ways of interpreting the lexical processing. We have to admit that words come in categories. And I'm going just to list a few contrasts here among many others. But categorical differences can be driven, for example, by syntactic category, being a noun or a verb. So nouns have its own noun distribution and verb has its own verb distribution, or by verb type. And then the last group, a group of words that can be used as a noun and verbs without any change in the form. Like visit, for example. You can plan to visit me in New York City, but you can also plan a visit, right? These words are very informative with respect to the nature of lexicon. Well, what's the mechanism behind this differential behavior is really not well defined. And in my research, I integrate the linguistic theory, robust human gathered data, as well as NLP data, with particular focus on the data collected from patients with different patterns of atrophy or brain lesions, which I think can provide really a complementary information to our field. So let's start with the first category distinction. So here I'll focus on 2 to 3 ways of conceiving nouns and verbs, among many others. And traditionally, these categories are identified by semantic criteria, what the word really means. However, such lexical item is a triple, right? It's three-way association among a meaning, a sound, and a syntactic category. Even more, the verb, for example, run, can also express an event which can involve one participant, in this case is an agent, one doing the run, and it's likely specified as a human or an animate thing. And although both semantics and syntax may play a role in both noun and verb categories, we may propose that there is some kind of division of labor between the two systems. And so, in the neurolinguistic view, we may think that noun have a higher weight on lexical-semantic system, and verbs kind of have a higher weight on lexical-syntactic system. However, there is an opposite view also that comes from the perceptual embodiment cognition, which, although both perception and motor areas have been implicated to different extents in the noun and verb categories, general division of labor was shown in terms of that primarily perception areas are recruited for objects and motor areas are linked to actions. But however, the question still remains, what is the role of semantic and syntactic systems in the neural distinction of nouns and verbs? And so this question, has been addressed previously with many different techniques. So there is evidence coming from fMRI, neuropsychology, ECOG, but I have to say that all these results are really mixed. So the results of fMRI studies on healthy people do not seem to converge on well-established patterns of cerebral areas. Lesion symptom mapping revealed a slightly better kind of frontotemporal dichotomy, but also really revealing overlapping neurocorrelates for nouns and verbs along the temporoparietal regions of the brain. And then the results from intraoperative studies have been also mixed, mainly studying picture naming tasks and including objects, and recent studies has included verbs and linked frontal areas for production of specifically finite verbs. So the question here is that, is there any evidence from neurodegenerative diseases? And so why would we study a neurodegenerative disease and ask these questions within this population? Well, why is it worth exploring this question of nouns and verbs and their distributional properties in PPA syndrome in particular? I think most of you already heard about primary progressive aphasia. There has been several lectures in this series focusing on this disease. But I'll just briefly mention why it's worth exploring a question in this disorder. First, all three PPA subtypes, they show changes in a language function, and they experience deficit in word finding. So they all exhibit lexical retrieval deficit. Second, distinct brain regions and their associated neuropathology is actually very distinct. For example, PPA disorders typically begin from a syndrome-specific epicenter very focally. And as the disorder progresses, then the spread of atrophy occurs by following specific neural network architectures. For example, here semantic, which is green, we have a left anterior temporal lobe, fusiform, inferior temporal, and hippocampus involvement, depending on the disease duration, right? And over time, it progresses posteriorly in the temporal lobe. So we can see that the pattern of atrophy versus what we already know about ischemic brain lesions are slightly different. And we can kind of, studying both, we can provide complementary information, and it gives us really a way to form our hypothesis. So this is what we did. We tested our hypothesis that nouns and verb naming deficits relate to distinct impaired mechanisms, lexical-semantic and lexical-syntax, respectively. And we tested this in the largest cohort of FTD patients and want to test across different types of disorders and atrophy patterns. It's important to mention here that this was done independent of diagnosis. So participants were presented with a picture of an object or an action and asked to name. And what I'm showing here is cortical thickness maps showing areas where cortical thinning was associated with naming nouns and with verbs. So specifically atrophy in the anterior temporal lobe area uniquely predicted noun production deficit once you control for verb production deficit. And atrophy in the pericilian network of regions uniquely predicted verb production deficit once you control the noun knowledge, right? The noun accuracy. So even more, we correlated these performances with additional tasks such as word comprehension test, and noun accuracy was associated with word comprehension, while verb accuracy actually was associated with both word comprehension, but also uniquely was associated with the sentence anagram task. So this kind of suggests that there is a functional dissociations in brain related to lexical semantics, possibly in anterior temporal lobe areas, and lexical syntax in this pericilial network of regions. So after this study, seeing this pericilial network for verbs, which is kind of a collection of multiple areas, I kind of felt that we need to identify their unique functions in the service of the verb processing. For example, we know that verbs are very complex. They encode for many different information, and we can think about their semantics, argument structure property, thematic roles, tense, agreement, and so forth. So any such study on verb processing must account how the rich information associated with a given verb is really processed. So let me give you an example. I'll consider these two types of verbs, right? They differ in meaning and morphosyntax. For example, the verb run, it's a heavy verb, to move from one place to another rapidly, versus, for example, light verb go consists of the semantic features that are moved from one place to another, right? Which is kind of a part of the definition of what a heavy verb run. So you can see how semantically they are different in terms of complexity. In terms of the argument structure, we can think that the verb run expresses an event which involves just a single participant, an agent, so someone that's doing running, right? And it's likely specifies a human. On the other side, we have the verb bounce, which assigns two thematic roles, an agent, the one that's doing bouncing, and the theme, what is being bounced. So words like bounce are also morphologically complex. We can see that they might consist of at least some representation of the root and also a tense feature. In this case, it's a past tense, right? Bounced. And on some accounts, I'm not going to go into details, but this is also true for irregular words like ran and run, because bounce and run are maybe equally morphologically complex. So this just tells you how variable verb representation can be. And based on the lexically driven models, we can consider that all this information, both semantic and syntactic, is encoded in the lexicon when the verb is encountered. So the question now, again, is what is the role of semantic and syntactic systems in the neural distinction of different verb types? So for this, we ran three studies. We looked at the verb semantics, verb transitivity, and verb morphology. And let's start with the verb semantics study. So here we examined the effect of semantics during the noun verb generation task. We kind of expected that there's going to be this heavy light verb differential behavior if semantic inputs is actually what is impaired, and it should be linked to anterior temporal lobe atrophy. So for this study, 73 patients were recruited through UCSF together with 31 healthy controls. We analyzed their performance on an auditory noun to verb generation task. They presented with a word ball, like a noun, and they have to generate the verb like bounce or kick. And so first what we saw is that there is this distinct patterns of errors that the three PPA variants can produce. So overall, logopenic and non-fluent patients had the lowest and highest accuracy, which is here with blue and red highlighted. And more interestingly is that we see different distinct errors in the two PPA subtypes. Logopenic patients produce the highest number of semantically related nouns. So for example, they produce baseball instead of the bounce to a noun ball. And on the other side, semantics actually gave us more light verbs. So they produce verb like take instead of the bounce to a noun ball. So we can see here that they show very distinct patterns of errors just on a single task, which is the verb generation, noun to verb generation task here. Critically, we also did machine learning analysis on these different type of errors, which yielded above chance classification of our patients in the corresponding group. And what this represents here is that you can classify patients based just on the error type better than chance. The chance here is because we have three groups is a 0.35. So your true cross-validated score is kind of close to 0.7, which is the orange line here. So these findings kind of indicate that error patterns on a single task are really associated with the breakdown at different neurocognitive mechanisms across our PPA subtypes. which we already kind of knew from some other tasks, like a simple picture naming task, but it's neat to show in a noun to verb generation task, when the participants are required to generate both, right? To understand and recognize a noun and also generate the verb. Then we investigated argument structure and morphology information that can be associated with a given verb. We did this in another cohort of PPA patients at Northwestern University. And we explored the neural mechanisms of the production of transitive and inflected forms. So for the verb transitivity, we use verb naming task, tapping into production of transitive, intransitive verbs, with the prediction that we might see this transitive, intransitive differentiation behavior if there is a thematic aspect of argument structure that's actually impaired. On the other side, for verb morphology, we use a sentence completion task, tapping into the production of tense, regularity, subject-verb agreement, so different factors of morphology. And we kind of expected that there is going to be this finite, non-finite verb differentiation behavior, especially if the tense and or agreement features are impaired, which should be linked to the posterior IFG area, which is shown in neuroimaging studies to be a region required for morphological processing. So the finite, non-finite distinction is a really neat comparison, because the finite verbs are the verbs that mark for tense, and the non-finite forms are forms that do not mark for tense, like you can think of the infinitive or the progressive ing form. So as I mentioned, we had patients look at events as I show here, and we asked them to name. Eat, for example, here can denote a relation between the eaters and the food, and it's kind of a two-place argument verb. And what we notice here is that what we found is that there is a transitivity effect, and specifically, the non-fluent agrammatic PPA patients had a greater difficulty producing transitive compared to intransitive verbs, as shown in red. No difference between the other, neither the logopenic nor semantic PPA showed significant transitivity effect. On the other side, transitivity was really associated with cortical atrophy in the left inferior parietal region in the brain, specifically angular gyrus. And so that was the transitivity effect. However, in contrast, for the morphology, the patients were presented with pictures. They had to also complete the sentence and inflect the verb. And here we also see a morphological effect, specifically in agrammatic PPA patients. They were more impaired in producing finite verb forms, those that mark for tense. And they did much better with non-finite verb forms, like those that do not mark for tense. And so this morphological effect was associated with cortical atrophy in the left inferior frontal gyrus, specifically pars opercularis, across the PPA subtypes. So we see a clear distinction about the morphological versus transitivity information encoded within the verb. So because our NEVI inflection test included also regular, irregular verbs and third person present plural and singular forms, we had a chance to compare production of these two types of forms, regular versus irregular past tense forms, and also the noun-verb agreement forms. And so what the PPA actually showed is that there is a different degrees of impairment across inflection types. So while agrammatic patients show deficit across inflection types, irrespective if the verb is irregular, or if it's agreement, we see that deficit in inflecting irregular verbs are really associated with semantic patients and with semantic deficit. And the deficit in subject-verb agreement, interestingly, were associated with logopenic patients. I have to say that this kind of trend for semantics in noun-verb agreement were really impaired for irregular items only. So really this notion of agreement deficit is likely linked just to the logopenic variant PPA here. So in summary, I think things to remember from these three studies is that semantic PPA patients with ATL atrophy tends to lose ability to retrieve semantically heavy verbs. And as I said, this kind of corroborates with models that heavy verbs are really semantically more specific. They might need to be constrained by semantic context, unlike light verbs, which are really, they have fewer semantic features. So, and they also occur more frequently. On the other side, the transitivity effect we see, which is associated with the left angular gyrus atrophy, it kind of implies that there is an impaired verb argument access across patients, and also it supports the role of the inferior parietal lobe as a lexical storage of argument structure information, as has been proposed by previous neuroimaging studies in stroke and in healthy people. Given the inflectional morphology results here, we find that there is a different patient deficit patterns, right? There is different degrees of impairment, and it's associated with the inferior frontal gyrus atrophy. And so because we know that inflectional morphology lies in the intersection of the syntax, phonology, and the lexicon, it's not surprising to see distinct patterns, right? So the non-fluent, usually in line with those accounts that both bounce and run, are equally morphologically complex. It seems that they have inflectional deficit across different types of words, regardless of regularity and also regardless of agreement. So speaking about it, it's just a general syntactic deficit in these patients. On the other side, semantic patients, while syntactic analysis is not impaired for regular irregular words in these patients, it seems that item-specific information and their associations in the mental lexicon is what was impaired, and therefore it affected only inflection of irregular words. And then lastly, the semantic, the logopenic PPA patients, interestingly, show this subject-verb agreement deficit. And I think it has to do with the linguistic dependency that relies on the memory retrieval. It seems that they had difficulty in binding these features to items in their verbal short-term memory, which we often know it's reduced in this population. So now I'm going to switch the gear a little bit. And for the last part of my talk, I'll focus on category ambiguous words. And I have to say, this is a very this is my favorite topic. And so category ambiguous words are really frequent in English language. And sometimes verb can denote states like brush, and noun can name actions like bite. And so the question here, it's interesting, right? It may be that new verbs or nouns come into the language only derivatively, right? We can postulate maybe that derived form, like a verb, noun-derived verb brush, is coming to the language to the noun by a silent affix that's phonetically empty and not pronounced. Similarly, bite may come to our language to the verb representation, again through the silent affix. So therefore, the verbs like brush and the noun bite are just morphologically complex. And they have to consist of at least some representation of the root that can or cannot be categorically specified. So one theory that can explain the properties of these words is zero derivation theory, and it existed in the literature in linguistics at least since 1960s. And so, you know, this theory actually has several tests that you can run on these items and prove it that they're derived. So, for example, you know, these derived verbs, they require an overt complement. So, for example, you have to say brush something or butter something. They also resist the verbal affixes. So you cannot verbalize them again because they were already zero derived from the noun. So unlike support can take an affix and be supportive, brush cannot have such instance. Also, there is this semantic dependency between derived form and the basic form, right, the noun. And Clark really identifies ways to establish these denominal verbs very neatly in their paper. And so what they suggested is there is different types of derived verbs. For example, brushing means grooming using a brush, like instrument verb, or buttering means spreading the butter, like a locatum verb. So what this tells you is that accordingly, the noun-derived verb brush necessarily implies the use of a brush, right? While to bite does not involve the use of a bite, right? It's very different kind of semantic distribution. And similarly, we can apply same test to derived nouns, and we can see and observe exactly the same phenomena. So Marchand identifies ways to establish the relational relationship between them, like a verb bite and the noun bite. And so a verb-derived noun bite, for example, implies a biting event, while noun brush does not involve a brushing event, right? So you can see that they're very distinct semantically and morphosyntactically. So now the question is brushing if processing verb brush requires really a processing a noun brush. So simply said, can you brush without a brush, right? So we tested this phenomena, and so far studies have exclusively investigated these unambiguous word forms in linguistics. But little attention is given to these forms in a clinical neuroscience. And so using a binary force choice response paradigm, we had people look at the images on the screen like this. They had a word, they had to indicate whether the determiner the or the infinitive marker to was compatible with the target nouns and verbs. And same for the ambiguous items. And in addition to experimental subjects, we also assessed whether a transformer-based machine learning technique for natural language processing, it's so-called BERT, would present the same bias as human participants would do. So simply asking, are people really sensitive to these differences between syntactic categories? Would they show any bias? And would the NLP BERT model that's acquired in a very similar fashion really assess presence of a possible bias like we would expect with human subjects? So we tested this in healthy with BERT and in stroke patients as well, with and without verb deficit. And so this study actually find that healthy controls, as you can see, there is a y-axis selection rate of the N2 for the 4 conditions, and healthy controls, aphasic individuals without verb deficit, and also the BERT model all showed base form effects. So meaning a noun bias, selection of the, for nouns like scissors and brush, and the verb bias, selection of to, for verbs like cut and bite. So this kind of bias existing across categories and across the 3 groups. However, the grammatically impaired aphasic individuals show only a base form effect only for nouns, scissors and brush, but really change performance on the verb conditions. I think what this data suggests is that the base bias effect really, it's an effect of morphological complexity in a minimal phrase building here and the lexical access. And furthermore, these results may show that there is kind of systematic agreement across people as to which form of the category ambiguous word is the base form. And so I think it was one attempt to test this kind of bias and implicit knowledge when it comes to making decisions related to syntactic categories. We further extended the study using a different paradigm and different population. So we tested this in the PPA recently using a picture naming paradigm. So we tested this category ambiguity and meaning relatedness using the same picture for noun and for the verb. With the hypothesis that it could be that those patients who struggle more with the, who has IPL network damage might have difficulty resolving the meaning or category of an ambiguous word and will be unable to differentiate ambiguous words, while in contrast, those that has more general semantic deficit and atrophy to the ITL network will probably have an impairment across different forms because it's just an evidence of shared feature loss. So to test this, we enrolled 27 patients with PPA and we're still collecting data. So I'll just give you a preliminary results from this study. So the healthy controls serve as a control condition, right, that our stimuli are okay. And so they all perform at ceiling. The difference in accuracy was noticed between noun and verb ambiguous word forms in logopenic. So they lose the capacity to differentiate ambiguous words as well. So they show this ambiguity effect, which is kind of suggesting that the homonymy and ambiguous items here may have special representation properties. So something about phonological cohort competitors, or like, you know, 2 categories that are just kind of affecting each other. So this effect was seen only in the logopenic. However, our semantic patients show deficit across categories and across ambiguous and unambiguous conditions, suggesting that that the ATL atrophy that's exists in this population is actually affecting a shared feature loss, and therefore, you know, having a naming difficulty across different conditions. So In summary, I want to wrap up what did we learn from atrophy mapping studies in a PPA so far. I started with this kind of notion, what's the role of the lexical-semantic and lexical-syntax system in word processing. And I want to really emphasize this kind of network distributed approach, instead just strictly talking about localization as interpretation here, because I do think that lexicon is a byproduct of these two subsystems. So what we see is that the PPA patients who show differential behavior on forms that are more dependent on input from lexical-semantic system usually have atrophy in anterior temporal pole, so anterior MTG region, that may be recruited together with posterior MTG area for naming nouns, heavy, irregular verbs. And so the damage to either cortical tissue may be sufficient to cause lexical retrieval deficit, as we see also in stroke patients. Another candidate for the lexical semantics, as we know from past literature as well, is the IPL area. So it seems that this inferior parietal region, it really has something to do with the agent recipients aspects of the verb meaning. So these kind of thematic relations, and also creating these semantic dependencies. So the category ambiguous words seems to rely on this network much more than unambiguous forms. So because the verb generally implies the use of a noun, and you need to make this kind of semantic thematic dependency between the two forms. And then the lexical-syntactic system seems to be relying on the two areas and creating this posterior inferior frontal gyrus that can be recruited together with posterior superior temporal sulcus. In this study, we show this for grammatical morphological processes. It seems that patients who cannot analyze regular past tense forms for verbs, but also irregular ones, their circuitry for grammatical analysis is definitely impaired, but their association in their mental lexicon is actually what's spared. And this has been shown with recently with minimal phrase composition that's relieved by intracranial recordings and other studies. So this network generally supports morphosyntax as well as verb retrieval. And it will be interesting for future studies to follow up on this silent morpheme that we see in the category change when we are looking at the noun-derived verbs, adjective-derived verbs, or maybe verb-derived nouns. But even irregular past tense may be, on some accounts, may undergo this zero derivation. So, you know, it seems that all these studies from stroke, from healthy people, and from patients with neurodegenerative disorders are really informative and also in a way that informs the field, but at the same time, you know, the clinical presentations of the patients. But I think I'm going to, you know, from the previous question, what are we missing? I'll slightly change the question. You know, how is lexical system really implemented in the brain? We're largely ignorant of this question. Even with all the advances of neuroimaging, no one really knows how the basic properties of the words are really implemented in the brain. And I think the complete account of lexical items or lexicon will need to state this and come up with some biologically informed mechanistic models of the lexical system. And this mapping problem has been already introduced by David Papel early on. I think it's also important to notice that it's difficult to devise a task that varies only one operation while holding the others constant. So just looking at a single task, you might not be capturing all the different linguistic processes. I think the ECOG studies now turning using not just the object picture naming task, but using verbs can be really, can allow us to evaluate distinct linguistic functions in a more systematic way. In my studies, I usually control for another variable. When I'm looking at nouns, I'm controlling for verbs and vice versa. Same for transitive, intransitive verbs, finite, non-finite verbs. So that's one idea to tease apart the processes in between the forms. And the third problem, I think what we're facing is that the lexicon can be expanded. Because we continue to learn open class words, nouns, verbs, adjectives throughout our lives, and we have the ability to create new category members. So I think this kind of notion that nouns can surface as verbs and vice versa, that originated from Clark and Clark early on, it's something to be taken into account when studying the lexicon. And how can we address all these different problems? Well, we have to really think about that studying neurobiology of the lexicon is necessarily interdisciplinary. We need to integrate various different fields to understand the neurobiology of lexicon, linguistics and neuroscience. Embodied cognition has its own view. Affective neuroscience, it's interesting avenue of new research where we can kind of bridge between language and emotions, and what's the affective lexicon and what's the linguistic lexicon, what do they look like? And then also understanding the mechanism that drive lexical system and cognition can really inform their dysfunction in neurological condition, and which is the primary goal of my research. So I think all these studies can improve assessment tools. We need novel theory-based assessment paradigms. The patterns of performance differ greatly even within one single aphasia type. I think this cannot be neglected. And then I believe that homonym studies I presented here with the category ambiguous word forms have big significance in forming ways to maybe facilitate word learning. For example, you can think about involving a picture of naming of one member of the word and then like generalizing to another member of the word form using our traditional phonological and semantic cueing hierarchy therapies. So with this, I want to thank to my colleagues, my collaborators. I want to thank you for your attention. I'm so grateful for many collaborators I have developed over the past few years and the current ones here in New York City. We are really working with magnetic resonance imaging facility at CUNY and developing very neat eye tracking plus fMRI studies on this. Thanks to my collaborators from different continents, for Dr. Valentina Borghesani and Adolfo Garcia, and to my Adelphi colleagues, specifically Drs. Koenig and Rendozo. And thank you for your attention.
Wonderful. Thank you very much, Sladjana. That was a great talk. And so questions are trickling in. Most of the questions so far have to do somewhat with IPL, angular gyrus, and the logopenic PPA. So let's go. I'm going to read a question from William Matchen, who also starts off the chat box with some fan mail to you. Greatly looking forward to this, he said. Do you think the agreement deficits in logopenic PPA could be due to representation of the syntactic relations necessary for the agreement computation itself? Are there ways to differentiate the phonological memory versus the syntactic accounts here?
So yeah, hi William. So thank you for your question. Well, a subject-verb agreement, I have to say, has not been tested in clinical population as much as like, traditional past tense, the finite, non-finite distinction. And so the way I see agreement is like, forming this linguistic dependency that can rely on memory retrieval. I think the subjects are generally in agreement with controller, like agreement with, let's say, non-targeted distractor. In this case, it was like, for example, the juice, like the woman drinks the juice versus, the juice kind of can be a distractor also, that, you may be targeting and mapping a verb with that noun instead of the subject noun. So that's kind of one thing. Of course, we cannot tease this apart. That could be one way, one factor that can influence the rate of agreement errors we see here. On some other representational accounts, I think difficulty in computing agreement can be just related to difficulty to bind this feature, right, with the item representation. So, this is all what I can think about when it comes, the explanation why we see the subject to verb agreement or noun to verb agreement, but is it computational in nature, or is it due to the item retrieval? It's kind of, it can vary, right? It depends on the atrophy patterns of the disorder we're studying, what's their, basic impairment look like. I don't know if I answer your question. Feel free to jump in, and I'm happy and open for discussion. This is a really new topic, especially has not been studied in logopenic at all.
You're getting a thumbs up from William, so
thank you.
It's a good sign. Next question is from Kirana Tsapkini. Wonderful talk. Thank you. I have a question about the interpretation of IPL as a lexical storage of AS information, our argument structure information. Could it not be that the inferior parietal lobe is a manipulation type node for argument structure, as it has been shown for working memory, and not storage? Also, for the class ambiguous verbs, were brush and bite different in their respective frequency as verbs? If so, it would not be related to syntax, but to lexical frequency.
All right. Hi, Kirana. Thank you for your questions. Let me wrap up one by one. So you're saying about IPL as a lexical storage versus more like a manipulation type. Well, I have to say that, if you think about manipulation and working memory, we're seeing here angular gyres, right? So we're not seeing more superior, like supramarginal gyres to the frontal area of the brain. That's more like a working memory, right? Manipulating items in our memory, like a digit backwards, right? That we use traditionally to tease apart that network. Here we are clearly seeing angular gyres. And generally, many studies that manipulated this, even in healthy people, this transitioning, like the number of arguments between the verb types, highlight the angular gyres area all the time. So now if it's the storage, based on some of the Cindy Thompson's work and others in the field, it seems that it's more like a storage that can be integrated then with the rest of the information in the posterior temporal lobe. Again, the argument structure is a very, we only tested one component here, but, different information can be coded there. So we can think about the type of arguments, we can think about the number of arguments, we can think about semantic and syntactic aspects of the argument structure. So here I'm just teasing apart the numbers, right? How many arguments does a verb take versus, and one verb takes more arguments than the other. So, I don't know a precise role, what's the IPL doing here, but definitely I am thinking it's not a working memory because it could be then more frontal parietal lobe, which is more superior. That's kind of my view. Okay, so, and the second question,
No, go ahead, sorry.
Class ambiguous verbs were brushed by different their respect. Yeah, this is the question that comes up all the time. And I have to say in my 2019 brain and language paper, I had to control for many different ways creating the frequency for these items, a surface frequency, lemma frequency, basic frequency, sum of the frequency. I mean, I have to say that I did all the different computations and all the items are really controlled. It's not the frequency of usage between the noun and the verb form. Well, Marantz recently proposed this nounness and verbiness effect. So that's something to look for. Maybe there is this initial bias that some items are more, having a higher nounness versus verbiness, which is not specifically a frequency, right? In our simple way, how we use frequency in language. So yeah, they're all match and it's really not an effect of frequency. I do think it's some implicit representation or knowledge we possess about these items in our life. And so if so, it would not be related to syntax, but to lexical frequency. Yeah. So then, yeah, it cannot be frequency. Hope I answer your question too.
Great, thank you. Your answer to the initial part of the question also actually relates to the question that I had put there as well. And I'm just wondering about that because in some other, experimental research, it's not always clear to what extent these transitivity effects differentiate, where exactly, right? So that's quite a big area that seems to be involved. You specifically name angular gyrus. So when you link the verb transitivity effects in PPA with angular gyrus atrophy, isn't it really the case that also, like the atrophy for logopenic PPA actually also includes posterior superior temporal gyrus, or maybe even middle superior?
Yeah. So yeah, the logopenic atrophy patterns definitely starts, there is kind of a notion like that, UCSF is doing amazing study now distinguishing two variants. Maybe the atrophy there is more supramarginal and there is that more ventral kind of type. And so what's happening here is that this is really a transitioning region. So if you use HCP Atlas, this region is really transitioning area between the supramarginal and angular. So it's not only angular, only supramarginal, but I really think it's that transition region between the two. So that's what I see, but it's definitely not a supramarginal in a way that we usually think about working memory and verbal memory.
I was specifically referring to superior temporal, so inferior to supramarginal.
Oh, okay. In terms of for the argument structure.
Yeah.
Yeah. Well, that's so it's definitely not. Yeah, I didn't really. My hypothesis was to use the 3 nodes I see in the verb network, and then see what each node actually, what's their contribution to the verb processing. And it seems that angular jars was the only one that actually was linked to transitivity effect.
Okay.
Of the 3 nodes. Yeah.
Yeah. Thank you. Just another comment, well, 2 comments, one from William, who says, I think agreement would be super productive as an avenue of research. And the other from Kirana Tsapkini, who says, thank you. I just think it would be non-economical for the brain to have such a huge storage in the parietal lobe.
Yeah.
We have a question from Yuan Tao. Thanks for the talks. The noun-verb ambiguity study is very interesting, but went a little too fast for me. What is the task exactly? Do you mean that PPAs lose the noun or verb sense of the ambiguous word, or the ability to select the correct sense, and so on?
Yeah, sorry, I speak fast in general. So there are 2 ambiguity studies I had. So one was the forced choice task, which was really like the written words that you have to choose between the and infinity marker 2. And the other one, I think they're referring here to the picture naming paradigm, that single picture elicited both a noun and a verb form, which are categorically ambiguous in nature. And so the reason, the rationale here is actually, and this is where we are, again, I'm so happy and open for any suggestions, but the idea here is that we are testing these 2 complementary accounts, the lexicalist and perceptual embodiment account, that I think they can converge on the same hypothesis here. So, and the hypothesis is namely that the dorsal stream with IPL hub will have a critical role in processing ambiguity, those differential elements that cannot be observed here, and more so in processing verbs compared to nouns. And that's what we kind of see in logopenic. In addition, the ventral stem, which we think it's more ATL hub, will have a critical role in processing objects and shared features across nouns and verbs, irrespective of ambiguity. And therefore, that's what we see in semantic parent PPA, where they just lost the semantic features, and therefore they cannot name neither a noun or the verb form of the picture. Now, if they lose really a noun or a verb sense, or maybe they just could not select the correct sense, you cannot test in a picture naming paradigm, right? This is more like the retrieval that can be due to either one or the other. They just don't have the sense anymore. The semantic feature is lost for both noun and verb, which usually it's what we see in the semantic variant PPA. But for the logopenic, it could be opposite. It could be the ability to select the correct sense. And that's especially harder in the ambiguous items.
Great, thank you very much. That brings us to the end of the questions, Sladjana. Thanks so much for your talk. Thanks to the audience for attending and for your questions. Bye, everyone.
Thank you so much. Thanks, everyone.